Hello, children of a lesser joint. Welcome to today's segment. Last time I left off by talking about how I created a rule-out list for my differential diagnosis, and I was working off of the overlap of symptoms and diseases associated with P. acne, and you saw I was able to expand on just one disease, one organism, and be able to branch out. I made brief mention of the fact that P. acne is also associated with different types of cancers, and I wanted to show you that one slide so that you can see what the types of cancers are. So we'll move forward from that. In talking directly about sarcoidosis, the category, of course, granulomatous diseases has great appeal for me. This particular disease, sarcoidosis, really captures my attention because of the peak incidence of the age at which it occurs, which is between 20 and 45 years old, reported in different literature reviews. There's also an additional spike that occurs at about 50 to 60 years old, and as I'm getting older, my patients get older, and I'm seeing an older age community that has an association with temporomandibular disorders. So when I talk about the 20 to 45-year-old group, I think about the sweet spot of the age prevalence that TMD is reported at, between 17 and 34 years of age. I also think sarcoidosis may very well be a disorder that's not considered very often as part of the rule-out list or my differential diagnosis. Almost every disease comes with a known list of body parts that it can affect. And so sarcoidosis, which is predominantly a lung disorder, is reported in about 70% of the presentations of sarcoidosis. But there are a lot of organs that it does affect. It affects the lymph nodes, the liver, the spleen, the skin, the eyes, the musculoskeletal system, which includes joints, muscle, and bone. The heart has some involvement in about 10% of the cases. There's a neurosarcoidosis, so there are neurological consequences. The parotid is involved, so there are exocrine glands that are involved. Kidneys, gastrointestinal system, as well as the endocrine and the reproductive systems. So sarcoidosis just doesn't affect the lung, where it's most commonly reported to be present. In terms of some of the constitutional symptoms that are associated with the respiratory area, we have shortness of breath, which is related to the formation of the granulomas, fibrosis, and anemia. And the patients typically present with wheezing, this intermittent dry cough, chest pain, and hoarseness. From the constitutional and musculoskeletal systems, we pick up the general symptoms of fatigue, loss of energy, malaise, feeling of not well-being. Weight loss is common. Joint aches are approximately 70% of the people who have musculoskeletal symptoms. Arthritis in 14 to 38%. The synovitis, which we also picked up as part of the P. acne and SAPO. Muscular symptoms range between 50 and 80%, and bone pain. And then we pick up some of the more generalized symptoms of headache and neck pain. It's a good place for me to let off today. I look forward to speaking with you again when I'll be rocking it out with Jaw Talk.